Okay, I think we've given it about a minute, so we'll get going. I see people continuing to pile in, but we will make a start. So thanks so much for joining us. I'm Suzanne Gaughan. I'm the President and CEO at ICHOM, and I'm delighted to be joined by my brilliant colleagues. So I'll just introduce my colleagues. So I'm joined by Alyssa Swift, who's going to be talking to you about benchmarking today. Dr. Greg Robinson, who's our Chief Technology Officer. He's going to be talking about technology and specifically around putting the sets on fire. Dr. Stephanie Wissig, who is an advisor to ICHOM and works across both the outcomes research team in the development of standard sets and implementation, but also in the benchmarking project as well. Dr. Luge Fiallo, I always mispronounce Luge's name, but she's so gracious that she doesn't mind. So Luge is also working in the outcomes research team and is a director in that team, and she's joined by her colleague, Dr. Zafir Dasgupta, who's also a director in the outcomes research team and is also rather heavily involved in the harmonization work that we've been doing. And she's also joined by Christina Nielsen, who's also working on that harmonization work. Irina Zolf-Rienzo is joining us from a benchmarking perspective. And I'm seeing so many boxes now on my screen. I have no idea if I've missed anybody, but I think that's everybody. I may have really offended someone there, but I think that's all of us. So what I'm going to do is I'm shortly going to hand over to Luge, who's going to talk to you a little bit about what's been going on with the updates and the creation of the sets of patient outcome research measures, and also the harmonization work that we've been doing. And then Luge will then hand over to Alyssa, who's going to talk to you about benchmarking. And then we'll talk to Greg about what's going on from the technology development within ICHOM and putting the sets on fire. So first thing to mention is this is being recorded, so hopefully that's okay with everybody. And the other thing is, in the top right-hand screen, if you're not on, if you select the option that says speaker rather than gallery view, it just means that you're sort of looking at the presenter at each time rather than everybody's faces, as lovely as they are. So I'm going to hand over now. We're going to spend about 25 minutes in sharing some information. And then what we're going to do is we're going to break into two groups. So one group will be talking or answering questions on the standard set development and the harmonization work, and the other group will focus more on technology and benchmarking. And you can just ask questions. We want this to be interactive. If you're too shy to put your hand up, then please just you can put your questions in the chat box at the bottom and interrupt us, because else this will be a very, very dry presentation. So please do interrupt us, and then at the very end we'll come back and just wrap up. So just make sure that everybody is listening to what I'm saying around interaction. So perhaps you might just post in the bottom, say perhaps who you are or where you're from, so we know that the chat functionality works. And then I'm going to hand over to Luge, and she's going to take you through an update from the updates from the outcomes research team and what's going on with the development of standard sets. Thanks, Luge.
Thank you so much, Suzanne. While I put my slides up, I'd just like to say that it's such a pleasure to be here and to see so many of you joining, and a great honor to be able to give you a little bit of an update on the work that we've been doing over the past 12 months. So I will start by telling you a little bit about the standard sets that we have been developing this year and our plans for the future, as well as harmonization of the sets, which you may have already heard a little bit about. So this year, you have already seen that we launched our Autism Spectrum Disorders standard set. This was made publicly available on the 23rd of June when we completed the set, and the materials, as usual, the flyer, reference guide, and data dictionary are available to you to download for free through ICHOM Connect, which you just need to log into, and then you'll be able to find the materials for the standard sets, just like all of our other standard sets. And of course, as usual, the manuscript detailing the work that was done in developing this set will be published in a peer-reviewed journal. And that manuscript is currently in preparation, so we hope to be able to submit that very soon. And of course, we'll keep you updated through our newsletter and usual outputs on when that happens. Other than that, we have been working on a number of sets this year. So currently in development, we have a standard set for heart valve disease, one for venous thromboembolism, and 2 mental health standard sets, one for neurodevelopmental disorders and another for eating disorders. So for all 4 of those, the working groups are currently active and are going through the consensus process to confirm everything that will be included in the standard sets. It does mean that those working groups are now closed, so we are not looking for additional working group members. But if you're interested in any of those areas, we would love to have you on our newsletter so that we can keep you up to date. But also towards the end of the project, we hold an open review period where we make a lot of the detail of the standard set available before it is published so that we can gather feedback. So if you have any contacts or if you yourself would be interested in being involved in that, then please reach out and we'd be happy to do that with you as well. We have also committed work for next year already. So we will be developing 2 standard sets at least, one for HIV and another for epilepsy. So we are in the process of recruiting the working groups for those 2 standard sets. And again, of course, if you're interested in that, please do reach out so that we can make sure we consider you or your contacts. And as usual, we are in discussions to launch additional standard sets. ICHOM will continue to be developing standard sets to cover conditions that are not yet part of the portfolio. And you've got a few on the slide here, including multiple sclerosis, multiple myeloma, obesity, asthma, and COPD. But of course, there could be others. And so we do say that if there's an area that we have not yet covered that you think would be of particular importance, or where you're trying to implement value-based care but don't yet have information on the outcomes and the outcome measures that you should be collecting, then we'd love to hear from you. So please do reach out. My contact is on the slide, but I also hope to meet a few of you in the breakout sessions in just a moment. And of course, you can reach out to us through our website as well. The other part of our work in outcomes research that I'd like to mention today is the harmonization that we've been doing for the standard sets that we've already developed, and that is also changing a little bit the way that we create new standard sets. So I'd just like to give a brief overview on that. Of course, it's been 10 years since ICHOM began, and at the stage that we started this work stream in 2020, we had created and published 28 standard sets. At this point, we are at 40. And of course, these standard sets were developed by individual working groups throughout the years at different times. And so we felt that there was a need to ensure that all of the items that were included in the standard sets were standardized and harmonized, and that we avoided any inconsistencies or discrepancies in the way that things were defined. So we held a harmonization process which used a machine learning methodology to ensure that any inconsistencies were eliminated and that we defined all the items in our standard sets in a harmonized way. So that was the work that was done in 2020 with the 28 sets that had been created to date at the time. And since then, we've also developed what we call our internal ICHOM term bank, which is now being used as our repository for all the variables that are included in our standard sets. And it does mean that all of our harmonized data dictionaries can be found in one place and are safe and consistent, and that we use that to develop all new standard sets. So all of the sets that were developed between 2020 and now have already been harmonized through this process, included in our term bank, and all standard sets that will be developed in the future will be using this terminology as well. Just to clarify, none of the content or meaning of the sets that you might have been using in the past has changed. We have simply made sure that everything is named and defined in a consistent way. So of course, there have been some changes, some very minor changes to the data dictionaries, and we've updated all the materials that are found on ICHOM Connect. So we do encourage you to use the up-to-date version. And additionally, we will be carrying out an annual review of both the data dictionaries and the actual content of the standard sets in the future. So do stay up to date and stay tuned, and we will be posting these on an annual basis on ICHOM Connect. That's all from me for now, but I will be in the breakout room on standard sets, so I hope to meet some of you in just a moment. And I will hand over to my colleague Alyssa Swift, who will talk to you about benchmarking and the work that we've been doing in that area.
Thanks so much, Luz, and it's so great to see in the chat so many people from all around the world. So that's very exciting, especially since our benchmarking platform is an international benchmarking platform, and we are very pleased about that. Could I have the next slide, please? So as Luz was just elaborating upon, over the years, we've developed a number of collections of patient-reported outcome measures. We have 40 of those so far. And Luz was just telling you about the many that are in progress or that we're thinking about bringing to fruition. And in addition to continuing our work on those, we're also really getting to a point where we want to scale the adoption of those sets as well as put them onto the benchmarking platform. These, a digital benchmarking platform, given the fact that our sets are standardized, one of the very powerful elements of those sets is the fact that we can really effectuate a direct apples to apples comparison of hospitals and hospital quality. And so we feel like this is the natural next step for us to take. Could I have the next slide? So our benchmarking platform is going to allow providers to view their quality performance and their quality performance relative to their peers. And they're going to do that through dashboards. So the dashboard is going to tell a hospital what their performance was, and that will be shown in green. And it'll also tell that hospital what the performance is of their peers. That peer could be, and that peer group could be, it could be local, national, or international. And each peer, when you're looking at the aggregate of your peer's performance, you can rest assured that there are at least 5 in that aggregate, otherwise we're not showing the aggregate. So the privacy of hospitals and their data is definitely going to be maintained. And you're also going to be able to see the variance of your outcomes and the variance of the outcomes within the aggregate. Next slide, please. So our technology partner in putting this together and putting together our benchmarking platform is MRDM Logics. They are a Dutch company, but we are also actively seeking technology partners to help us with the implementation on the hospital level. We're seeking these technology partners internationally. So if this is something that you're interested in with helping with the technology implementation within hospitals, we would be very pleased to have you. Next slide, please. Just to give you a quick sense of how it is that a hospital gets up and running on the benchmarking platform. First, as this was elaborating upon earlier, the hospitals will be collecting data according to these sets of patient outcome measures, according to the specifications as outlined by ICHOM. So you'll collect that data over a period of time, at which point the data will then move over to the platform either through a batch transfer or fire entry. Before it goes live onto the platform, MRDM is going to conduct some validations. So making sure that dates are formatted in the proper day, month, year format, making sure that there aren't any patients in the data that have a birth date before 1900, things like that. At which point, once the data has been validated, the data will go up onto the platform in the form of dashboards, and you'll be able to see your performance, see your performance relative to your peers, and that performance will be risk adjusted according to ICHOM's proprietary risk adjustment methodologies. Next slide, please. We're very pleased that our first sets that we're putting onto the platform are breast cancer and stroke. And we have had a number of inquiries so far, but if you are interested in benchmarking on breast cancer and stroke, please do let us know, and please come and talk to us about it in the Q&A session. Next slide, please. So after breast cancer and stroke, we are giving very careful consideration presently to the sets that we would like to see next on the benchmarking platform. And we're looking at such factors as demand. What are the hospitals that we're talking to asking for? What's the benchmarkability of the collection of patient-reported outcome measures? Meaning, how clear are the KPIs, the key performance indicators? How clear are the time points for collecting the data? We're also looking at the potential of that particular set of patient-reported outcome measures to impact quality. And finally, we're also looking at the simplicity of implementation. So how complex are those patient care pathways? Is there more than one patient care pathway, et cetera? And next slide. So that is my very brief overview of the benchmarking platform, and we look forward to taking your questions in the Q&A. And at this point, I will turn it over to my colleague, Greg Robinson.
Thanks, Alyssa. We have actually had a brilliant question from Camilla, so I thought we could just take a moment to answer that. Does the platform have integration with electronic medical records, and if so, which ones?
Integration. Well, I think that, I mean, the electronic medical records certainly are, I don't know if it's, I wouldn't say it's integrated, and I can also let Greg expand upon that more broadly, but I would say the electronic medical records will be key in making the data transfer over to MRD and Logix. But Greg, do you have any additional insights to provide there?
Yeah, absolutely. So the benchmarking platform itself is not integrated with any EHRs presently. It is something that's under discussion. Of more relevance, though, is really more the integration or the gathering of the data from the EHR, and to the extent that whichever EHR you're using, be it Epic or Cerner or others, is able to integrate the collection and storage of PROMS data, which then makes the whole process and an experience of gathering the data that represent the actual individual outcome measure set a lot easier. Once those data are actually gathered, then it's just a matter of shipping it over to our benchmarking platform, which, as Alyssa noted, we're moving towards supporting FHIR next year, but also just transport using secure FTP or otherwise. Hopefully that addresses that question. If not, definitely feel free to reach back out in the chat, Camilla. But we can move right into my slides. Luge, if we can go to the next. So we're going to speak a little bit today, really briefly, about where we're moving in 2022 and beyond. Almost crazy that this year is almost at the end. But we are moving towards, so our existing, so flashback to a year ago, and we have pretty much all of our measures in PDF format, which meant a little bit of a heavy lift in terms of trying to both interpret and gather the data to make them useful as it relates to all of our measure sets. In the past year, we have moved that PDF format into a nice, readily usable digitized format, supporting both XML and JSON to enable really a more distinctive data collection process. And then also in the past year, in conjunction with our excellent partner Medtronic, we've mapped a lot of our terms to standard ontologies SNOMED, and LOINC, and we're also moving towards additional mapping into an ICD-10 format as well. All of this really to enable just to reduce the burden as it relates to data collection overall. How can you most easily do easy turn over to your IT department or analytics department or yourself, do simple SQL queries, query the database, the underlying EHR, get the data out, again, using existing standard mapped codes, and then putting it into a solid format. And FHIR is just that next version of that, really. So with FHIR, both specifying, and for those that are not completely familiar, FHIR is an acronym that stands for Fast Healthcare Interoperability Resources. I'll say that again distinctively. Fast Healthcare Interoperability Resources. And it enables both the transport of the data and the specification of the data in a specific format, so that put this term exactly here in the data set. And then once all of your data are actually gathered, extracted from the relevant sources, the EHR, et cetera, then transported either into our benchmarking platform as supported by our FHIR endpoint, or in support of your own individual learning collaboratives. You can use, just have it all basically on FHIR, which makes it a lot easier overall. Next slide. The first set that we are moving forward with is our breast cancer standard set. And it's really about taking, there are a lot of existing FHIR resources published through HL7 that we're going to be reusing a lot of those terminologies to keep everything standard within the HL7 community. And we will be publishing our own FHIR implementation guide, and we're presently supported by a couple of the existing HL7 work groups behind that, particularly around clinical interoperability, clinical decision support, as well as a couple of other interested parties or work groups within HL7 to really help. And there's a lot of excitement and a lot of energy around getting our sets on FHIR, which will be immense for, again, both the data collection and the transport of data, just in support of learning collaboratives, benchmarkings, or even just internal analytics. Next slide. So with our FHIR implementation guides, really it's the amalgamation of creating the FHIR profiles so that we have the actual index events that are stated and mapped out. We have the patient-reported outcomes, there are observations, there are all of these different FHIR artifacts and maps, that will be developed to help to both measure and report on data as our standard set specifies. And then another thing that we've moved towards pretty ferociously in the past year, and we're moving forward even more ferociously in 2022 and beyond, is that notion of the temporal nature or that indexed event for the standard set, and then having measurements or the stratifications of the particular measure based around that event. And all this will be supported within our FHIR profiles and within our FHIR implementation guides. I believe that brings to the end of this session, or my particular part of the session. Turn it back over to Lucia.
Brilliant. That's great. Thanks so much, Greg. I believe now is the time to start picking which breakout room you would like to go to. So if you scroll to the bottom of your screen where it says breakout rooms, you can select the one that you'd like to attend. So the first option is the benchmarking platform. The second option is standard sets. So in standard sets, they're going to be covering harmonization there as well. And in the benchmarking platform, they're also going to be covering technology and the content that Greg was talking about. So now is the time to start joining rooms. And what we will do is we'll give ourselves a little bit of time, give people the opportunity to ask questions of the speakers, and then we'll come back together at the end of that session. So we'll give ourselves, kind of 20 minutes or so. And once we kind of get to a point where people are questioned out, we'll come back together briefly, and then the conference will be over for another year. So if you're able to select the room that you'd like to go into, that would be great. And if you just can't decide, then if you sit here too long, then someone will decide for you. So go ahead and pick, and I'll see you in a breakout room shortly. So for anyone who didn't hear the wrap up because they were in the standard set room, I just wanted to thank you all so much for giving up your time. I know it's a huge commitment, and your participation makes these events really very, very valuable. So thank you so much. We're very much looking forward to seeing you in person next year. We're going to be back in Boston to celebrate 10 years of ICHOM. So it will be a big deal, and I think the conference will feel quite party-esque as well next year. So that is to look forward to. Details will be sent relatively soon with confirming the dates, and there'll be emails. You can pop your details down ready for next year. Thank you so much for giving your time to this session as well. And if there is any unanswered questions from your perspective, then do reach out to us. All of our details are on the ICHOM website. So thank you so much.